AM and 95.3 FM, the Health and Wealth Radio Network. Tune in for Barry's Supplement Hour with Keith Nevins every weekday morning at 11 a.m. WNN.
Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV.
Now you can get Talk 1470 WNN on 95.3 FM too. Loud and clear, Health and Wealth Radio, WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we're teaching you how to live a longer and healthier life. I'm Lorena Anderson, your host for this evening. We air on Tuesdays between the hours of 6 and 7 on 1470 AM and 95.3 FM. We are being presented by Amp2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. In case you have to miss tonight's show, you can always go to allcountyhealthcare.com and see any of the shows. They are archived there. All County Healthcare happens to be a Medicare certified home health agency. So in case you have any questions whatsoever about your home health, please give Maddie a call at 888-717-7170. She would love to answer any questions that you might have. And for tonight, if you have any questions for our doctors, please call 888-565-1470. And just to give you a heads up, we have an orthopedic surgeon on tonight, and we also have a plastic surgeon on. So get your questions ready, give us a call, and we would love to hear from you. So, without any further ado, I would love to introduce our first guest, Dr. Clive Woods. He happens to be a foot and ankle orthopedic surgeon, and he's got quite an expertise, and I also heard that he's quite a sports fan, especially football. So, welcome, Doctor. Thank you for coming.
Thanks for having me.
Oh, absolutely. I know how busy you are. Yeah. And especially right at this moment, because you're getting ready, not only for the high school students, the grammar school students, middle school, but also, we're going into our football season, and that happens to be one of your specialties. Yeah. So, tell me, where did you do your schooling?
Okay. So where I started, I did my undergrad at Florida State University. And then from there, for med school, I went to Mary Medical College, which is in Nashville, Tennessee. And then I came back to Miami, where I'm from, at University of Miami, did my residency there. And then I did an extra year of foot and ankle fellowship at Florida Orthopedic Institute, which is in Tampa, Florida.
Oh, wonderful. Wow. So a native.
Yes.
That's not very common down here, but love to hear it. Yes. That is wonderful. What ignited your passion for this?
Well, the first thing was when I was a kid, I had asthma, so I was always in the pediatrician's office. So that's when I decided I wanted to be a doctor. Then when I got to college, I liked sports a lot. And so I was like, what kind of doctor is on the sidelines? And then I saw it was the orthopedic surgeon. and that's how I decided to become an orthopedic surgeon.
Oh my goodness. Excellent.
Yes.
Have you gone to a lot of football games?
Oh, yes. For undergrad, Florida State, Dolphins game, I'm always there. Yes.
Oh, yeah. It sounds like you're a season holder, huh?
Yes.
Season ticket holder.
Oh, yes.
Oh,
Yeah.
good for you. Good for you. So let's talk. I want to find out more about the injuries that can occur, especially in the football or any kind of sports, because being down here in South Florida, we're always doing some level of sports. So talk to us about that.
Yeah, so I mean, now especially it's football time. So a lot of the injuries that we're seeing is ankle sprains, which is very common. The other things that you can sometimes see is Achilles tendon tears, foot fractures, which there's a couple in the NFL where people are out for a couple of probably 2 months or so. In addition to that, there are midfoot sprains, which we call Liz Frank injuries, turf toe. All of these are different injuries you can get.
Not heard of turf toe before. Explain that to us.
So what turf toe is that before football was played on just normal grass. And what happens now on that artificial turf, there's a little bit of resistance. The floor is a little harder. So the wide receivers, when they're pushing off, they use that big toe to kind of get a little push off, and the toe gets hyperextended, and sometimes they can get pain that way.
Wow. I've not heard of that, turf toe.
Yes.
Well, and I can understand now why something like that would happen. Because you're right. You've got to dig in when you're taking off.
Yep.
So, and some of the other things that you are dealing with, especially, with football coming up.
Yes. So, I mean, the other things, like even now, I've had a couple of Achilles injuries that have come into the office. Some football, actually some from the hurricane, where I actually had one lady that had a shutter actually cut the back of her Achilles and cut it that way. So that's another way you can get an injury. Not really a sports injury, but with Irma, everybody's falling off ladders.
You're right.
Putting up shutters.
So, and I just want to take the time out to send our thoughts and prayers to all of our fellow Floridians that have been hurt so badly in this hurricane. We're hoping that everything comes back to normal as quick as possible.
Yes.
But so that was our Hurricane Irma that you were speaking about.
Yes.
And what do you do then? If you've got an Achilles tear like that, what are some of the surgeries? I would imagine it's a surgery that you have to do on that.
There are two options. There is always non-operative with no surgery and operative. The benefits of the operative procedure is the chance of re-rupturing it is less likely. So if you have a football player or a basketball player who tears their Achilles, majority of the times that's something you would fix because they can go back to that sport and actually tear it. As opposed to if I have my 50-year-old or 60-year-old, if they're diabetic, there are ways that I can treat that non-operatively also. The biggest thing with surgery is the wound complications, but nowadays the surgeries have become minimally invasive where literally I can do it through like a little small incision and actually have you walking and with a boot and actually a heel lift in 2 to 3 weeks. And then where before it was 6 weeks where you couldn't even put your leg down.
Yes. I mean, I remember one of my friends had, and this many years ago, had that Achilles tear. And then the way that they tried to mend it, by putting the
sutures.
And the tendons on top of each other and trying to suture it up and everything. And he was in a cast for at least 8 weeks.
Oh, yeah. Well, nowadays, the rehab to get back on your feet is a little quicker. As far as to get to full function to play basketball, that still takes some time, but you can at least get back to your activities of daily living a little quicker.
Well, that's good. That's great news.
Yeah.
What are some of the other things that you work with as well? Like the ankle sprains you were talking about?
Ankle sprains.
And what do you normally have to do with the ankle sprain?
A lot of times for the ankle sprains, I have an article out there that's in the Spectator that says it's not just an ankle sprain, because a lot of times I get people coming from the ER that they just have an ace bandage and then 4 weeks, 6 weeks later they're like, my ankle still hurts, doc, what's going on? And I treat ankle sprains a little bit more aggressively. A lot of times I'm putting you in a Cam Walker boot, which is a control ankle motion boot that you can walk on. And that lets the ankle rest, but still, once again, kind of continue your activities of daily living. Then once the pain gets better, then I get you into ankle lace-up brace. And we'll also have a little bit of physical therapy, whether in our office or there are exercises that I can teach you to do. And most of the times, once you do that, you get back to where you need to be. Sometimes people can have ankle instability where they have constant ankle sprains or roll in their ankle. That can be sometimes a problem, and that's when surgery comes into play. But once again, there are minimally invasive surgeries that you can do that can actually get you back on the field quicker.
Wow, that's really, that's so different from how it used to be. Yeah. That's great. You know, and you mentioned your office and that you also have physical therapists there. Yeah. Why don't you tell our audience how to get a hold of you?
Oh, yeah. You can catch me on Facebook, Clive Woods MD. Our website is gelbmd.com. Phone number is 561-558-8898. I was going back to my Miami days. And in addition to that, we're open from 9 to 5, so give us a call and we'll definitely get back to you.
That's fabulous. Yeah. And, I also love the fact that you have physical therapy right there in the office as well.
Yes.
Because then you can watch the strength coming back. And also if there's any kind of difficulty that they might run into, it can be addressed immediately.
Yeah, that's always the most important thing. That's why we like having physical therapy in our office. If I have a surgical patient, let's say they're not progressing well, or the therapist doesn't know whether they can be a little bit more aggressive, I'm right there. They can just walk over and say, well, so-and-so is having this problem, or, can we start this activity with this person? And they can get that answered in, less than 5 minutes.
Wow. Yeah. Give us some of the insight. If we think that we have a sprain, what are some of the things that we need to be aware of so that we can get ourselves to the doctor instead of walking on the sprain?
Yeah. So the biggest thing, what everyone knows, is the RICE, which is rest, ice, compression, elevation. So the first thing that you would do if you feel like you have a sprain, mostly it's going to be on the outside portion of the ankle. You definitely want to get off of that ankle, get it ACE bandaged, and also try and ice it and elevate it to help with that swelling.
Okay. Yep. Do you also want them to have anti-inflammatory as well?
For sure. They can use their ibuprofen, Aleve. You just have to be careful. If you're on blood thinners sometimes, you have to be careful about that. But most of the times you can use your anti-inflammatory to help with that inflammation.
Well, I would think, though, that if you happen to be on any blood thinners, you would absolutely want to go to the doctor. Yes. Do not wait.
Yes, exactly.
And I have a personal story about that, too.
Yeah?
Oh, yeah, because my boyfriend ended up slipping and falling in Venice.
Oh, wow.
In Venice, Italy. And he thought for sure it was a sprain. No problem whatsoever. 10 days later, he goes and takes an X-ray.
Yes.
It was broken.
Oh, yeah. I had that actually today.
Did you?
Yeah, a 16-year-old that was training for soccer, and he was doing ladder drills where you run, post, go back to the other post, and then keep going back and forth. And he was like, I felt the crack, but I felt like I could walk on it. And Dad's in there. I'm like, yeah, he broke it.
Oh my gosh.
Yeah. Sometimes you can have a fracture that you don't realize that it's actually broken, and you're walking on it, and most of the times what I hear is, I figured it should go away by now. It's been 3 or 4 weeks.
Exactly.
Yeah.
And so that's one of the reasons why I asked you that question. So audience, honest to God, I mean, one of the things that I now know is that if the swelling doesn't go down,
yes,
and and it still hurts, go to the doctor.
Exactly.
Get an X-ray.
Quickly.
Call Dr. Clive Woods.
Yes.
He will be there for you immediately.
Yep.
What's your telephone number so that they have it again?
The telephone number is 561-558-8898.
Great. And you're located where?
I'm located on 9980 Central Park North. That's right in front of West Boca Medical Center.
Oh, okay. Yes. Great. I'm becoming familiar with that area.
Yes.
Super.
Yeah.
So what are some of the other things that you are dealing with?
One of the actual things I actually had one of my college running backs come down today to see me about is what we call a Jones fracture. This is actually one of the even though it's a simple fracture, it's very hard to heal. And what a Jones fracture is, when you actually break what we call the metatarsal, the fifth metatarsal. What the metatarsal is, if you look at my hand, I'll use my hand, but it's really on the foot. It's a bone that kind of extends from the small toe in the foot. And a lot of times that area has very bad blood supply. And when you're somebody competitive like this person who's a college running back, you actually fix that to get them back on the field, because one of the things that can happen is you can put them in a cast or boot and it doesn't heal, and instead of being out for 8 to 12 weeks, that can turn into 3 to 6 months because now it didn't heal. Now you have to go back and do surgery. So one of the recommendations for that is, if you're a competitive athlete, we usually fix that.
Oh, good. Yeah, that's always good to know.
Yes.
Because I had one of those.
Yes.
And I wasn't a competitive athlete, but then, it was surgery. They put a pin in, the cast for 9 weeks or whatever. Yes.
So it's actually nowadays, like, for example, that's one of the cases I have tomorrow. It's small incision. You put a wire down the actual canal of the bone, put a screw over it, and I'm literally incisions probably about that.
Oh, my gosh.
Yeah.
That's amazing.
Yeah. Nowadays, technology, there's a lot of things we can do minimally invasive.
That is it's so amazing, and that's one of the reasons. That's why I love that All County Healthcare has sponsored their show, because we get to bring in the experts, the professionals, to help educate us and give us insights about the state-of-the-art technology that's offered to us now. So that's fabulous. Some of the other things, how about bone and joint infections? Can you talk a little bit about that?
One of the things that I actually have had a couple of people come in the ER with infections recently, and this is something that probably can go for everyone out there. The one thing that I've had is recently 2 people that had just simple abrasions on their knees, just a little cut. One guy was a shopping cart. One guy slipped off of the back of his truck bumper and scraped his knee. And with all the hurricane and trying to lift things, they didn't really pay it attention, and they ended up with infection of the bursa. So it's a little fluid sac that's in front of their kneecap. So that's one thing you have to be careful. If you get these abrasions, you need to get them nice and clean. Sometimes you can use Neosporin, triple antibiotic ointment, whatever to stop the
bacitracin.
Bacitracin.
Love that stuff.
Exactly. So any one of those things they can definitely use to try and prevent the infection from coming in. If they see any redness, definitely come in sooner, because some of them actually waited and then it turned into an abscess, which I actually had to drain.
Oh, geez. Oh, wow. Something else that I had noticed too, there are occasions where, someone will get like a puffiness on the back of their knee.
Yes.
What is that?
Oh, well, that...
one of my...
what they call it is a lot of times the Baker cyst. And what a Baker cyst is, everyone knows like the ganglion cyst, which is on top of the wrist, or what they call the Bible bump, because the nun used to hit it with the Bible to pop it.
No, it was really the ruler.
Yeah, exactly. Yeah, the ruler. But the Baker cyst, what it is, it's a fluid-filled cavity that forms in the back of the knee. So sometimes you can see that with people with arthritis, which I'm pretty sure some of our viewers out there have these Baker cysts. Things that we can do for that is drain it. So you put a needle in there and kind of drain that fluid out. Usually most of the times what people will feel is a little bit of lack of range of motion. It feels stiff. So when you're trying to extend your knee all the way out, or you're trying to flex it, it just feels like something's tight back there.
Wow. Yeah, that's important.
Yes.
One of my clients was working out, and the back of her knee had that great big cyst. Now, does it come back or does it leave?
Sometimes it can come back, because I always try and tell my patients when you drain a cyst, sometimes we try and put cortisone in there to stop the inflammation from reoccurring, but you're just putting a little small needle and draining this, so that sac is still there.
Right.
So if you do anything to kind of flare it up, so let's say you go back running or anything like that, that can definitely fill back up and cause that puffiness again.
Wow. Yes. Okay. Well, thank you for that. Yes. Some other things that you are dealing with.
Yeah, so, well, the other thing that I actually do, besides foot and ankle, I do trauma. So at West Boca, I do a trauma call. So one of the things that honestly has happened recently since Irma was a lot of hip fractures. Yeah. So what ended up happening was with power being off, a lot of our elderly population is walking around trying to find things, and they're falling on their hips. So, I mean, just last week alone, probably did a good 5 to 10 hip fractures just from people falling on, trying to find things with the lights off.
Wow. And what do you do for that?
So there are different types of hip fractures that you can get. It depends on where the fractures are, but there are really 3 types of surgeries that you're normally going to do. If it's a fracture of what we call the neck of the femur, most of the times if that doesn't move, you can put screws in it to hold it in place and allow it to heal. If it does move, then that's when you're doing what we call a hemiarthroplasty. What that is, everyone knows about total hips. This is a half of a hip. So you're not really replacing the socket, just the ball in the neck. And then if you get a fracture of what we call intertrocks or subtrocks, which are more in the femur range of the shaft, those are fractures that we actually put a nail and a screw in. And the reason we do this is trying to get you up the next day, sitting up, eating breakfast, lunch, and get you walking.
Wow. Yeah. So you see that with a lot of the elderly population then. Okay, so one of the most important things to do, if you know that there's a hurricane coming, always keep a flashlight next to you. Especially, as you said, people were falling because they couldn't see where they were going.
Exactly.
So flashlight, very, very important. I think we should come out with flashlights that go around the neck.
Yes.
What do you think?
Well, yeah, that'll be good. That's like the med alert that they have.
Exactly. The two of them together.
Exactly.
Okay. Let's see. Ankle fusion.
Oh, yes. So another thing that I deal with is people with ankle arthritis. And when you have ankle arthritis, there's actually a couple of options that we can do for this. The gold standard was what we call ankle fusion, which is actually putting screws or sometimes even a rod across the ankle joint where you get rid of that motion so that they don't have the pain. But with technology kind of advancing, now what we do is ankle replacements. So everyone knows about shoulders, knees, hips.
Yeah.
But there are also ankle replacements, which you can actually replace that joint. And it's pretty cool because even one of the companies that I use, you can get a CT scan of the ankle. They send it off to the engineer, and the tools used to kind of shave the bone to put in the replacement is tailored to you. So that's one of the cool technologies that's there.
That's very cool. Yeah, because you need your foot.
Yes.
I had noticed it just when I had the
fracture.
Yes, and you're pretty. What are you going to do now? You're gone one leg, your 2 hands are on crutches, so you're pretty immobilized.
No, I've noticed that a lot too, where some people have simple foot fractures. Like, it doesn't really hurt, but you can't walk on it. So it becomes really hard. The one thing that you can do, what a lot of my patients have, is what we call a knee rolling scooter. Because sometimes with those crutches, your shoulders start bothering you. Then you're telling me about the rotator cuff. So these knee rolling scooters, you just put your knee on it, and you can be pretty independent on the knee rolling scooter. And a lot of times, a lot of my patients are just like, you see them through the office. You got to put a speed limit up in the hallway.
I know. And I'm familiar with that as well. Yes. To be honest with you, we had the little knee scooter. And we've got the bell on it.
Oh, yeah.
We've got the cup holder.
Yeah. Well, they have all-terrain
and the
wheels.
basket. Yes.
I had a gentleman that tore his Achilles, and he was a construction worker. And he goes into, he's like, "Doc, look at these wheels." And he has these all-terrain wheels. I can go on the construction site and everything. So they're coming up with everything.
Yes, we've had lots of fun with that. We've gone to dinner and we park it on the side, and the waitresses like to come and play with the bell, and or they take it away, and we say, "Okay, wait a minute now, we're going to check the mileage."
Oh yeah.
Be careful.
I have one
charge.
patient. I have a picture of him where he had, for every ride was like 50 cents or something
I love
like that.
it. I love it. That's super. Yeah. Okay, let me see what else. Broken toes.
Yes. So one of the things I also kind of deal with is people with fractures of their toes. A lot of times when people see toe fractures, say, there's nothing the doc's going to do for that. Really what we're trying to do for toe fractures is more for comfort and cosmetic. So if you see your toe, especially the small toe, which is a very common toe fracture where you're walking, let's say in the middle of the night, and you hit that dresser, or, usually that hurts big time. Yeah. So a lot of people break toes that way, and what happens if you leave it that way, where it's hanging out, sometimes that can become difficult for shoe wear. So sometimes I may have to set that, buddy tape it to another toe to allow it to heal. And a lot of times what I would put you in is what we call a hard sole shoe, so it doesn't bend when you're walking, so it works more for comfort.
I see. Okay. Wow, we're just flying right through. Yes. I love this. I love this. Post-traumatic ankle and foot correction.
Oh, yeah. So the other thing that I also do is, if someone has like a flat foot or a high arch, sometimes that can become really painful. Actually, one of my good friends, who's a trainer, he had, that's how we became good friends, but he comes into the office like, I can't train people anymore. And he has these athletes that he's training and customers, and it's like, I can't demonstrate anything because my foot hurts. And what he had was what we call, big word, posterior tibial tendon dysfunction. And really what it is a severe flat foot where the tendon is no longer functioning correctly. So usually what you would have to do for that is a whole reconstruction where you kind of transfer tendons, making cuts of the heel, sliding that over. And then the other thing that you do is get him nice orthotics, and now he's back to training. He trains me still. Yeah, so that's good.
Okay.
Yeah, he's probably watching.
Hi.
Yes.
Excellent. The other one also, because I've got a couple of friends that have this, is the plantar fasciitis.
Oh, yeah. Now, there are a lot of tricks for plantar fasciitis. Sometimes when you come in the office, I'd say there's good news, there's bad news. The good news is that it's going to go away. Bad news, it sometimes go away when it wants to go away. There are a couple of tricks that we can try for plantar fasciitis.
Okay.
Icing the heel is one. The coolest trick is getting a water bottle, throwing that in the freezer.
Okay.
And then when you get that bottle, when you come home, you take that bottle watching your favorite TV show, put it on the bottom of your foot, and you roll it back and forth. And what that does is it stretches the plantar fascia, but also ices that area.
Oh, I like that idea. So that's a great idea.
Yeah, that works very well. Sometimes you can even put a golf ball underneath there and kind of, it's like kneading dough. So you're trying to stretch out that plantar fascia. Okay. Other options are never walk barefoot. That's one thing. Sometimes what you can get is sandals with a nice cushion.
I heard the plastic.
Yeah. There's one there's a sandal called like a visco heel, which is like very thick. And it's just a nice cushion for the heel. That can work. And then good orthotics, like soft orthotics, you can get your Dr. Scholl's or anything like that. And that kind of helps. And there are also some stretches we can show you for that. The other thing that we're doing now is what we call PRP, which is platelet-rich plasma. And that's an injection that can help with inflammation of plantar fasciitis. If you're trying all these other things and it's not helping, that's now one of the treatments that people are trying to do.
That's very interesting. Yeah. Now, some people might not understand what PRP is.
Yeah.
So explain to them exactly what that is.
Yeah, so
we got a few seconds here. So
PRP is platelet-rich plasma. So simple procedure, you come in the office, your blood is drawn, same way if you were going to your doctor to get labs. There's a centrifuge. The centrifuge spins the blood around, and what it does is separates the plasma layer from the red blood cells and the white blood cells. The plasma layer has platelets in it, which has growth factors and things that help with inflammation. We take that, we inject it. Once I inject that, usually you're going to be in a boot for 2 weeks to let it rest, and then we'll start some stretching activities after that. And that works pretty well. I mean, we're using it for tennis elbow, we're using it for insertional Achilles problems, plantar fasciitis. It's being used all across the medical field.
That's fabulous. Yeah. That another state of the art.
Yep.
Oh my gosh! I'm so glad that you were here.
Yes.
Thank you for educating us. And
no
and I've got to tell you, please give our audience your name, your telephone number again. And I've got to tell you, he's just got wonderful bedside manner. I mean, fun and exciting to talk with, and a wealth of knowledge.
Thanks.
Please.
So my name once again is Clive Woods. You can call me at 561-558-8898. I'm also on Facebook, Clive Woods MD. Our website is gelbmd.com. That's GELBMD.com.
Beautiful.
Thanks.
Well, thank you. And
All
thank
right,
you for
thanks,
being part of the show.
Thanks for having me.
And we're going to go on a commercial, so stay tuned. Don't leave. We'll be right back.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. It's great to be here. I'm Lorena Anderson, your host for this evening of You and Your Doctor, where we're always teaching you how to live a healthier and longer life. And sponsored by All County Healthcare, where patients are the heart of their business. Well, I have another wonderful doctor on, a plastic surgeon, and I can't wait to introduce you to him. He's talking about some of the specific areas that he is an expert in, and we are blessed to have him. So welcome. It is great to have you.
Thank you.
Appreciate you coming in, and please tell us a little bit about yourself.
All right, my name is Matthew Goodwin, Dr. Matthew Goodwin. I'm a plastic surgeon, been working down here in South Florida for about 10 years. Came down here in 2007 after I finished my training.
There you go.
I finished my, I did a microsurgery fellowship in breast reconstruction and cosmetic surgery in Baltimore.
Really?
This is after I completed my plastic surgery residency at WashU St. Louis. Did general surgery at the University of Minnesota and med school at Yale, undergraduate at Princeton. Brought me to my family brought me to South Florida, my wife's family, and we love it here. I'm not going anywhere.
We like
and
that.
Recently, I joined a new practice called Inspire Cosmetic in Delray Beach, Florida, with a few other plastic surgeons. And
Wonderful.
we're trying to just provide excellent care, top-notch, safe surgery, and great results for people in our
Well,
community.
I've got to say, I don't believe that you would try at anything. My whole point is I'm sure you are doing an amazing job. And especially with that kind of education under your belt, that's really quite amazing.
Thank you.
Yeah, so welcome. And how long have you been down here? I'm sorry?
10 years.
10 years.
Yeah.
My goodness.
Yeah.
Well, that's great. So you said you just moved. So you're in Delray?
Well, I've been in Delray.
Okay.
And I was in another practice where I've done a lot of breast reconstruction when I came down here. After being trained in advanced techniques in breast reconstruction, that was a large part of my practice. But it's a good way to develop cosmetic surgery as well.
Oh, yeah,
and so
absolutely.
I'm doing a lot of, body contouring, a lot of complex cosmetic breast reconstruction, a lot of revision breast reconstruction, combined with just the regular breast augmentations and tummy tucks and liposuction. And
well, with the reconstruction, give us a little bit more insight, just to help educate our audience here, because you mentioned quite a bit of various reconstructions.
Right. So reconstruction most of the time is for women who've had breast cancer.
Oh, okay.
And they've had part of or their entire breast removed. And so then you're reconstructing the whole breast. Most commonly, we're using a prosthetic or an implant. And just like the types of implants we use in cosmetic surgery, they come in all types of implants now, and there's lots of tools at our armamentarium. In addition, we also have reconstruction that uses your patient's own tissue.
Really?
Using the abdomen, back, sometimes other distant sites.
Wow.
And more, we're doing other techniques like fat injection. Sometimes we use various biologic meshes and matrices to help hold up the breasts and do whatever we can to give the breasts a nice natural shape and form.
That is absolutely wonderful.
Yeah.
And something that it's so essential, because at that point, losing a breast, it almost feels as if you're losing part of your femininity.
It's extremely traumatic for women.
It is, yes.
And it's something that we do our best to try and give them back what they had. It's never going to be the same. But sometimes patients are, sometimes they like their new breast better than their old.
Well, I can understand that too.
Yeah.
Occasionally that does absolutely happen.
That's a home run when we can get that.
Oh, yeah, that is fabulous. That is fabulous. So what are some of the new techniques? Because I remember that, it doesn't seem that long ago, but where they were doing like the anchor and the lollipop, the anchor meaning underneath, and then coming up around the nipple area and then removing a lot of that tissue. What are you doing now? What's
so those
up
are still techniques that are tried and true and are still done, but there's a lot of new options, such as new types of implants, like I said. So there's saline breast implants, and then there's silicone implants, and now there's a whole bunch of different form stable implants that can help provide a little bit of lift for a patient without having the same amount of scarring that they might have had if they required an actual breast lift with the anchor scar. Or sometimes we just do like a J incision. Everything we do, we try to hide or minimize the scarring. But sometimes if there's too much skin, you can't get away without having that scarring.
Right.
We also sometimes, like I said, use some additional material to help hold up the breast longer, some biologic meshes. And these are things that have been developed over the past few years that, I have a lot of experience in using it from breast reconstruction and is getting employed more and more with cosmetic surgery.
So then that would help lift the breast?
Almost like an internal brassiere.
Well, that's very interesting. Yeah. Without wires, huh?
Yeah.
Oh, that's wonderful. That's great to know. So that was the cancer, and some other women that just are naturally overly well endowed. How can you help them as well?
So breast reductions. Okay. The goal of a breast reduction is obviously to remove the volume of the breast, but you're getting a breast lift as well. We're trying to give a nice shape to the breast. And that scar can vary as well. At a minimum, there's a scar around the areola and usually a vertical one underneath.
They call that the lollipop, correct?
Lollipop, right. And some patients are just want to know, why can't we just go around it and pull it together that way? And unfortunately, the breast doesn't shape very well doing that, and so it can sometimes flatten out the breast.
Okay.
So you have to add some extra support underneath to help hold that breast up and give it that shape that's nice and round underneath and give a nice natural scoop at the top.
Yeah, I was going to say, because sometimes, the older that women get, the less of muscle that they have at the top.
That's right.
So it can look a bit distorted almost.
Well, the body changes throughout your life. Breast changes with hormonal changes, weight changes, skin thins. And these are things that we try to think about when we're doing the surgeries on patients, but they have to understand that they might need a touch-up. Body's going to change, just like you would change if you didn't have surgery.
Right.
And but there's a lot more available to our armamentarium now to treat those things, which is pretty cool.
I love that. Now, you did say something about fat injections. From what I've heard, that's kind of the new up and coming.
That's one of the new things that we use fat injection all over the body. Most patients have a little bit of fat to give that can be used as donor tissue, that can be a natural filler. Basically, we're harvesting that fat with liposuction, concentrating it, preparing it, and then we inject it in very small droplets and try and place it very spaced out in your tissue so your body can develop its own blood supply.
Wow.
Not all the fat's going to survive, though, and that's very technique dependent. Everybody, the studies kind of vary in saying how much fat survives, and I think it depends on the surgeon that's doing it, the health of the patient. Most of the time, in my hands, I think about half the fat survives. And so typically you try and put as much as you can to get there to survive. The patient's going to have a lot more swelling afterwards if you put more. And after about 6 months, the amount that's there is what the patient's typically going to have.
Very interesting. But that only now, where do you see you putting the fat? I mean, which areas are most common right now?
Down here in South Florida, putting it in the buttocks is very common. We do it a lot, and there's a name some patients call it the Brazilian butt lift.
I've heard of that.
Yeah, which isn't just putting the fat into the buttock, but it's also just sculpting the buttock and shaping the buttock, taking away from the areas that kind of take away from the cosmetic appearance of the breast, like the lower back, the upper hips, and sometimes the flanks and the medial thighs. But then putting the fat in the upper and central portion of the buttock to give it a little more projection. We also do it in breast surgery, both cosmetic and reconstruction.
Really?
To treat little asymmetries, little defects and deformities. And we use in the face, sometimes when we're doing facelifts or even when we're not, just to give a little more volume to the cheek, sometimes the temporal areas. It's a very useful technique. The thing about it, though, is compared to fillers, which you can just get off the shelf, you don't have to worry about that gaining a blood supply. And so you just kind of put that in.
It's all healthy, it's natural, and it's organic, and it comes from your own body.
Right. It's all
the only thing is that you have to wait for 6 months to find
see
out
the final result.
Yes,
right.
I'm like, oh my gosh.
Well, we get close to there at about 1 to 2 months, but some of it continues to dissipate over that 6-month period.
Gotcha. Well, I was you first for talking about the Brazilian butt, and I'm sitting there thinking, okay, well, one looks nice, and the other one kind of a little flat yet.
We try to make things as symmetric as possible, and you're right, nothing is perfectly symmetric, but my goal is to make them as symmetric as possible.
Well, you know something, absolutely. Dr. Goodwin, please tell our audience how to get a hold of you.
So I'm at Inspire Cosmetic Surgery and Med Spa in Delray Beach, Florida. The phone number there is area code 855-467-7473, or you can remember it as 855-INSPIRE.
Oh, I like that.
Yeah.
855-INSPIRE. And you do feel inspired.
Yeah.
You know, when you have the ability of coming and seeing yourself, and then you start rejuvenating yourself, and feeling younger and more healthy and more vivacious.
Absolutely.
I mean, it's an amazing feeling.
And there's so many options out there.
Oh, yeah.
So many things you can do. This is what drew me to plastic surgery, is because it kind of inspires you, all the things you can do to help people. It's amazing what the human body does when it heals.
Yes. And, I know that a lot of people right now, they don't experience their age. It's like they are so alive.
Well, that's what's so great about being here in Florida.
Oh, yeah, but you're not kidding.
People kind of find the fountain of youth. They live longer, healthier lives.
Yes.
And if you're able to, why not live a beautiful life?
Absolutely.
Yeah.
And at least have the rest of your body look how you feel on the inside.
Exactly.
Because I'm 62, and 61.
You're 62?
Yeah.
Oh, great.
Thank you. But I feel like I'm 42. So, it's wonderful. I do have to say that I do use some fillers.
All right.
And I feel wonderful. And it's like the body is experiencing what's going on the inside. So I highly
What's great
recommend
about the
you.
fillers is without a lot of downtime and without
Right.
any scars, you can kind of hide some of those things of aging, which are just superficial, and they're pretty safe.
Yes.
And so it's that's what everyone's looking for. Everyone's looking
Absolutely.
for a natural appearance,
Yeah.
but still to take away the things that make you look aged and tired without a lot of downtime, with nice reproducible results. And that's
Yes.
what's great about fillers, Botox. There's newer technologies, energy devices that can do that as well.
Tell me about it.
Radio frequency, laser devices. These are all things that we're going to be providing at Inspire. And,
So it's-
surgery is not for everybody.
Right. Yeah, absolutely. And the longer that you can not do surgery, the better off you are, I believe.
Well, it depends. Surgery is sometimes going to give you a more noticeable result, and some of these technologies are just going to give you a more modest result, and that may not satisfy. You may require multiple treatments. Finances are always a consideration, and sometimes having multiple treatments will end up being more expensive than having surgery. But surgery is going to require some downtime. It's going to require a period of recovery. There may be scarring. And nothing is without risks. Everyone's
Right.
looking for the holy grail. In my opinion, the fillers and the Botox are the closest thing to that. But that being said, they all require some upkeep. They require some repetitive treatments. Having a breast augmentation has very minimal scars. It has very reproducible results.
Yes.
And it has become pretty safe. But there's a period of recovery that patients need to undergo, and
Right.
so it's nothing is the holy grail.
But we're getting
We're
closer,
getting
though.
closer, though. We're
Yeah,
getting
especially
closer.
with a lot of the state-of-the-art
Yeah.
technology that they have these days, and especially, 5 years ago, you didn't really hear about fat injections and how you can use your own fat, to reproduce some of those areas that
That's right.
aren't as fat anymore.
And they're going to continue to come up with newer products where
yeah.
people can get some fat off the shelf, hopefully, and don't necessarily, if they don't have enough donor site or don't want to give it. These are things that are on the horizon.
Are they?
Exciting.
What else is on the horizon?
Well, these technologies, these radio frequency and laser devices, they continue to improve. Everybody complains about skin laxity, complains of cellulite appearance, and
Creping. Oh, yes.
Surgery is not great for treating those things.
No.
Deflated tissue is a component to it, but it's really part of aging as the collagen weakens and the skin becomes more thin. It looks older, and so if we can come up with some technologies and skin creams, these all continue to improve, and so you can kind of throw all these different devices at it and get a noticeable result, but it takes some upkeep.
Yeah.
You know?
Yes. Well, I kind of figure it's kind of like going to the dentist.
Right.
You go
Exactly.
once every 6 months. You get your teeth cleaned.
Exactly.
You get everything checked.
That's a great analogy there.
Yes, and you're feeling good and better, and your teeth are happy. So when you go to your plastic surgeon, such as
That's
yourself,
right.
and you get a little bit more of the Botox or the Dysport, or the Restylane or Juvederm, whatever it may be. It's just part of the upkeep, and you
right.
feel good and you feel better about it, and especially when you have somebody qualified such as yourself.
Thank you.
Always very important, and I kind of say that, with some people, because I've known that, and I'm not saying anything about dentists, but I've known some dentists to be doing the Botox injections and fillers.
Everybody's doing it down here.
Right,
you know?
and I'm like, this is your face. Go to a qualified plastic surgeon who's got all their credentials, and you've done the gamut by all means.
Well, I will kind of stay off that topic about some of the other fields doing it, but everybody's kind of getting into it.
Yes.
We're living down here in a society where all of us want to live that lifestyle. Want to have that sort of, we want to look good. We
Yeah,
want to
and
feel good. We want to go out and do that. And so more and more people are getting into it. And so it's not it is understandable.
Oh, it is understandable. Yes. Because as I said, we're feeling, especially down here, you feel so young, you feel so alive. Everybody is outside. They're athletic. They and retirees. Are you serious? The baby boomers,
right?
They're full of life, and now it's time to enjoy all the hard work that they've.
That's right. And I sometimes can't tell how old people are. They look so good.
Well, thank you. So it's just it's so nice to have the ability of looking the way you're feeling. And I love the word inspire, because when you're feeling really good and healthy and full of vim and vigor, you're inspiring to others.
That's right. That's right.
Oh, that's a beautiful name. I'm loving it. What are some of the other things that you also work on that you can share with us?
Well, I do the whole gamut of cosmetic surgery. I don't do noses. I don't do genitalia. There are some other surgeons in our facility that do that.
Okay.
But I do a lot of body contouring.
Is it more of the liposuction?
Liposuction, about tummy tucks.
Okay.
Buttock enhancement. We can do liposuction in any part of the body, arms, thighs, and obviously the abdomen and back. And as well as the minimally invasive treatments.
I don't mean to interrupt you, but with the liposuction, when you end up removing, say just the fat in your abdomen, the skin, what happens with the skin then? Does that tighten back up, or is it kind of still loose?
So it depends on the patient.
Okay.
And that's part of the examination to see how elastic the skin appears in examination. This is something that changes with age as well. If a patient has very loose skin and you take the fat out of it, then you're deflating it. And kind of like a balloon, it can appear more deflated. And so sometimes without some skin tightening procedure, which usually involves a scar, tummy tuck, you can't get that back.
Right.
And so sometimes you have to, but it depends. If sometimes patients have nice elastic skin, you do some liposuction, it's going to all adhere down. And so the goal is to have the superficial skin heal to the deep tissues without it being loose.
Yes.
And have it appear nice and natural.
I like that.
Yeah. And we're able to become more and more sculpting of the abdomen.
Really?
Try and define some of the patient's muscles, and sometimes give some of that muscular appearance that patients have a little bit, accentuated, and let the shadows that make these muscles appear more pronounced. If that's their goal, we can do that with liposuction as well.
Okay. So are you talking about the cellulite and
I'm talking about
legs
if
and the
patients
butt area?
want their muscles in their abdomen to appear more defined, you can do that and accentuate it with some of the liposuction techniques.
Oh, so that six pack that's been hiding underneath all this.
That's right.
I could find it again.
Maybe.
That's excellent. I
Right.
love to hear that. And there's another big thing out there too called cool sculpting.
Yeah. So cool sculpting is a type of minimally invasive fat removal device. It basically freezes the fat, and your body will absorb that fat over a period of months as well. Again, it's like that holy grail. People who don't want to undergo liposuction, don't want to have that recovery period. They want to have this procedure done, which does work.
It does.
But it is more modest of a result than you typically have than you will with liposuction.
Gotcha.
And so it definitely works for some patients. If you have that loose skin, it's not going to be great for you, because just like liposuction is going to make that worse.
Okay.
But if you just have a few areas of some excess fat and you want that sort of bulge to go down, that's where it's perfect.
Gotcha.
And there's a couple other brands that work with similar technologies. One that works with radio frequency, another works with laser. These all help break down that fat. And it's debatable between each practitioner which is more effective. They all work, but they're all very modest results compared to actually removing it directly with surgery.
Gotcha. Well, one of my other dear friends, she had a probably like a laser machine. I think it was called Venus Freeze. And that seemed to really work very
It worked well for her.
Yeah. worked well for me
And
too.
it was for the veins?
No, it was for the neck.
Oh, for the neck?
Yeah, to smooth the neck and everything. You know how sometimes we get those rolls of the wrinkles and everything.
Sure, yeah.
Yeah, it's worked fabulous.
Oh, wow. All right.
Yeah.
We'll have to look into that one.
Okay, cool. Excellent. Yay.
Well, we're going to have all these devices, or all these technologies available at Inspire. And so if people are interested, give a call.
love that.
And we'll set you up for a
So you have
consult.
somebody else in the office then that can do noses?
So Dr. Schnitt does nose. He's a craniofacial trained surgeon.
Oh, okay.
He does a lot
Okay.
of noses.
That's great to know.
And both Dr. Schnitt and Dr. Jackson, another plastic surgeon there, they both do genitalia surgery as well.
Okay.
Vaginal rejuvenation. Dr. Schnitt also does some gender reassignment surgery, some of the things
Okay,
that
that's important
we
too.
offer there that's not available everywhere in the area.
Right.
We have a board-certified anesthesiologist there, Dr. Jackie Tudevin, that's involved with all the surgeries that are done there. And so safety is the most important thing there.
Wow.
And so we're just
And you
trying to-
do surgery right in your office, or do you do it at the hospital?
both.
Okay.
I do it both, and it kind of depends on the extent of surgery, whether I'm combining it with some other reconstructive procedure, what the patient's goals and desires are.
Okay. What about hand and wound? Do you have somebody also in your office that
No,
can do
because that gets so this office is mostly a cosmetic surgery
Okay.
center. I do breast reconstruction and some skin cancer reconstruction, but I don't do a lot of hand surgery. There's some other specialists in the area that are better for that.
Okay,
Yeah.
great. Well, and tell us again, how do they get a hold of you, doctor?
So again, my name is Dr. Matthew Goodwin at Inspire Cosmetic Surgery and Med Spa. Phone number there is 855-467-7473 or 855-INSPIRE.
Inspire,
Yeah.
855 Inspire. That is absolutely wonderful. Thank you so very much.
Thank you.
It's been an absolute pleasure, and I've got to tell you, this man has got credentials that you very seldom see with other plastic surgeons. How long have you been in business, by the way, in your
10
practice?
years.
Wow.
So I've been at this practice since May.
Okay.
But I've been down here in South Florida out of training 10 years.
Okay.
Yeah.
Excellent. If you have any questions whatsoever for the doctor, please give him a call. And if you didn't get his telephone number, you can always call All County Healthcare, the sponsor of the show this evening. Ask for Maddie. She can be reached at 888-717-7170. And she can give you the doctor's information, Dr. Goodwin's information, just in case. Well, absolutely. And fabulous bedside manner. It's really been such a gift to be able to sit down and talk with
You're
you.
making me
and
blush. Thank you, though.
Oh, good.
Thank you for having me.
Excellent. Well, there's nothing better than a doctor that you would never guess was a doctor.
Yeah?
Because they're so personable, they're warm, they're caring, they can tap into the emotions, and something especially in plastic surgery and reconstruction, breast reconstruction, that is so very important. So
Well, that's a big fulfilling part of my work, and that's why I'm
Yeah.
not giving it up.
Yeah.
It's obviously very rough on patients, but a lot of patients get through. Most of them get through and survive. They're survivors, and
and then they
they're gonna
become
get by.
thrivers.
Thrivers,
Thrivers.
exactly.
Yes.
And
So thank you so
whatever I
very-
can do to help with that, it makes me
Thank
gives
you.
me a lot of joy.
That is wonderful. Thank you. And thanks for joining us tonight. I'm Lorena Anderson, your host, and we'll see you here next Tuesday between the hours of 6 and 7. Until then, have a great week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those